Hi, my name is Alana and this is my health assessment practical. The first thing I'm going to do when I enter the room is I'm going to wash my hands thoroughly for at least 30 seconds. Next, I'm going to close the curtain for patient privacy. Then I'm going to introduce myself to the patient. Hi, my name is Alana and I'm going to be your student nurse today. What is your name?
Camilla.
Where are you right now?
In the hospital.
And what is today?
Friday.
Based on this information, I can tell that my patient is aware, awake, and oriented times 3 to the person, place, and time. I can also tell important information for the Glasgow Coma Scale. In the eyes section, she scored a 4 because her eyes opened spontaneously when I walked in the room. In the verbal section, she scored a 5 because she responded appropriately verbally to me. Now I'm going to test for the motor section. Please squeeze my fingers. Great. She scored a 6 in the motor section because she was able to respond to my verbal command. She scored the highest score possible, which is a 15, which means she's conscious. The lowest score possible would be a 3. Next, I'm going to ask her a few questions. Do you have any allergies?
No.
Do you take any medications at home?
No.
Any herbal remedies?
No.
Do you have a past medical history?
No.
So why are you in the hospital today?
I had a seizure.
Have you ever had a seizure before, or have you experienced epilepsy?
No.
Did you experience any strange smells or sights before you experienced your seizure?
No.
And was your seizure witnessed?
No.
If she responded yes, that her seizure was witnessed, I would ask her the following questions. How long did your seizure last for? Did you experience any head trauma? Did you lose any bowel or bladder continence? And now I'm going to start with her vitals. The first vital I'm going to do is I'm going to do her heart rate. I'm going to take this using her radial pulse. Our normal pulse would be between 60 and 100 beats per minute. And I'm going to take her radial pulse for 60 seconds, noticing any irregularities. Okay, and using 2 fingers, but not my thumb because it has its own pulse. Next, I'm going to move her arm and cross it over her chest, and I'm going to assess for her respiratory rate. Normal respiratory rate would be between 12 and 20, and I'm going to count each inspiration and expiration together as one breath. So I'm going to also count this for 60 seconds. Next, I'm going to take her temperature. I'm going to take her temperature orally by putting the thermometer under her tongue. A normal temperature I would expect would be 96.4 to 99.1. And next, I'm going to do her blood pressure. This is going to be with the 2-step method. The first thing I'm going to do is I'm going to estimate her systolic number, blood pressure. So I'm going to do this by feeling for her radial pulse while I pump up the blood pressure cuff that I place with enough room for 2 fingers underneath so it is not too tight. So I'm going to pump up the cuff, and at the number when I stop feeling her pulse is my estimated systolic. So that number, I'm going to add 20 to 30 millimeters of mercury to that in order to assess for the real blood pressure. So to assess for the blood pressure, I'm now going to take my stethoscope, I'm going to place it over her brachial artery, and I'm going to pump up the cuff to that number with an added 20 to 30, and I'm going to slowly let out the air. And the first sound that I hear is going to be her systolic number, and the second number that I hear is going to be her diastolic number. So a normal blood pressure would be between 90/60 and 120/80. Next, I'm going to take her oxygen saturation using a pulse oximeter. I'm going to put that on her finger, and the number for oxygen saturation that we'd expect that's normal is above a 95 to an 100. So then I'm going to ask her a question about her pain. So are you in any pain right now?
No.
On a scale of 1 to 10, are you 0 to 10, are you in any pain? With 10 being the most pain you've ever been in, and 0 being no pain?
No. 0.
Okay. So she has no pain, so now I'm going to move on to circulation. I'm going to do an inspection of her skin tone and coloring, and from what I can tell, it is congruent with her ethnicity. So now I'm going to look at her capillary refill. So I'm going to pinch her tip of her finger and nail bed, and I'm going to blanch it to have no color. And then when I release, it should refill with color within under 2 seconds, which it did. And then I'm going to feel for her temperature of her skin. So I'm going to use the dorsa of my hand to test for her temperature, and it should feel warm and dry. Next, I'm going to start with her pulses. Pulses are taken on a scale from 0 to 3, with 0 to +3. 0 being no pulse at all, which has to be confirmed by a medical provider. 1 plus being weak and thready, 2 plus being normal, and 3 plus being bounding. So I'm going to start with the pulse on her temple. Okay, and I would take these pulses for 60 seconds. And I would do carotid. It's important to take this on only one side as to not occlude blood to the brain. Then I'm going to do the apical, which would be right over the apex of the heart. Then I'm going to do the brachial. And then move down to radial. And I would do femoral, which is where the groin meets the thigh in this region. And then I would do the popliteal, which is behind the knee, and the posterior tib, which is on the medial side of the ankle. This side. And then the dorsalis pedis, which is between the big toe and the first toe, pressing down on the bone. It's also important to take pulses using 1 or 2 fingers, but not your thumb because it has its own pulse. Next, I'm going to take a look at her thyroid. I'm going to inform the patient that I'm going to be coming behind you and I'm going to be feeling your thyroid. Is that okay with you?
Yes.
I'm also going to have you drink from this cup so I can feel what it's like when you swallow. I'm going to displace the throat. I'm going to displace the throat so I can get a better feeling for the thyroid on either side. It's important to note that the right side is going to be is anatomically a little larger than the left. And I'm feeling for tenderness, and you don't want to feel any lumps. That would be a bad sign. Okay, great. Then now I'm going to feel for the lymph nodes. They should be soft, movable, and non-tender. The first one I'm going to test for is the preauricular. So that's going to, I apologize. I'm going to have her drink from this cup and swallow while I feel for the thyroid. So can you drink from that cup? Great. And I'm feeling for what it feels like when she swallows on both sides. Okay, now I'm going to move on to the lymph nodes, as I said. So that's the preauricular. Front of the ear. You do this bilaterally. And then the posterior auricular. Next would be the occipital, the back. Submental right under the chin. Submandibular along the sides. Jugulo-digastric. Superficial cervical here. And then I do the deep cervical chain by bending the neck over. And the supraclavicular, I'm going to have the patient shrug. Can you shrug for me? Great, inside. Perfect. And now I'm going to do the axillary, which would be in the armpit, and then the epitrochlear, which I feel for above and below the crease of the elbow, and then the inguinal, which is where the groin meets the leg again. Okay. Then I'm going to move on to the cranial nerve assessment. So the first one we do is cranial nerve 1, which is the olfactory nerve, and that is a sensory nerve, and I'm going to test that by having the patient cover one nostril at a time and breathe in so I can make sure the airway is clear. Great, and now the other side. Great, and now I'm going to have her close her eyes, and I'm going to provide common scent under each one of her nostrils. Test each one individually. Okay, great. And then I'm going to do the other one. She would respond with, if she responded with the appropriate smell, then that would be the correct response. Okay, great. And now I'm going to do number 2, the optic nerve, which is sensory. So I'm going to do this by doing the confrontation test. So I'm going to have the patient stand up. And she's going to cover her left eye, and I'm going to cover my right eye. And I'm going to stick my fingers out in 4 different positions, and I'm going to ask her to tell me when she can see them.
I can see it. I can see it. I can see it. I can see it.
Okay, great. And I would do that on both sides bilaterally. Next, I'm going to move on to cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens, which are all motor. So I'm going to do this by doing the Perla assessment. So Perla is pupils equal, round, and reactive to light. So I'm going to test that by shining the light in the patient's eyes. So I'm going to come from the right, and I'm looking for direct constriction in the right eye. Now I'm going to do it again, and I'm going to look for consensual constriction in the opposite eye. Now I'm going to do it on this side, looking at the same eye for direct, and now the opposite eye for consensual. Okay, and I'm also going to have the patient look in the far distance, and I'm going to, that allows for the pupils to dilate, and then I'm going to tell her to focus on the tip of my pen. I'm going to bring it in, and I'm looking for them to constrict and converge, which they did. Great. Now we're going to move on to cranial nerve 5, which is the trigeminal, which is both motor and sensory. So I'm going to do this by doing the cotton wisp test, and I'm going to test with the cotton wisp. I'm going to have her, with her eyes open, I'm going to put the cotton wisp on 3 spots on her head, here, here, and here, and then I'm going to have her close her eyes, and I'm going to put them there, and I'm going to have her point to the area where I'm touching, where I touched. Okay, great. Next is cranial nerve 7, which is the facial nerve, and that's both motor and sensory. And I'm going to test this by having the patient puff up your cheeks, and I'm going to have you smile and frown. Great. And then there's cranial nerve number 8, which is the vestibulocochlear, which is a sensory nerve. And I'm going to do this with the whisper test. So I'm going to have the patient stand up and stand there, and I'm going to stand behind the patient, and I'm going to whisper, and I'm going to have them to repeat the words I say. I'm going to say 3 2-syllable words.
Hamster. Broomstick. Couch. Okay, great. And then I'm going to move on to test cranial nerves 9 and 10, which are glossopharyngeal and the vagus nerves. And these are both motor and sensory. So I'm going to do this by using a tongue depressor and my pen light, and I'm going to have the patient stick out their tongue, and I'm going to look for the soft palate to rise and for the uvula to be midline. Next, I'm going to move on to the spinal accessory nerve, which is motor, and I'm going to have the patient shrug their shoulders. Great, and keep your arm down, turn your head to the right, turn your head to the left. Great, and now I'm going to put a little resistance. So, shrug your shoulders, great, turn your head to the left, great, and turn your head to the right. Great. And now, lastly, I'm going to do cranial nerve number 12, which is the hypoglossal, which is motor. So I'm going to have this by I'm going to test this by looking at the patient's tongue. I'm going to have them stick out their tongue. Great. I'm looking that it doesn't have any fasciculations and that it is midline. Okay, and now I'm going to move on to the cerebellar functions. First, I'm going to do motor, which I'm going to start with the Bromberg test. So I'm going to have you stand up, please, with your feet together. Great. And I'm going to stand here and prevent them in case of a fall. And you're going to close your eyes and you're going to try and stay. Okay, great. That's the Bromberg test. And if we're looking for any sign of falling or instability, a little bit of movement is fine. Next, I'm going to do the rapid arm movements test, so you can take a seat. And I'm going to have you, this is also a sensory test for cerebellar function, and I'm going to have you alternate your hands, palms, and dorsum of the hand on your knees, and increasing speed to test for cerebellar function. Great. Next, I'm going to look at some of the sensory functions. So now I'm going to do sharp and dull. I'm going to break a tongue depressor, and I'm going to have sharp side and dull side. I'm going to show the patient where this is the dull side and this is the sharp side, and then I'm going to test in multiple locations on the arm and ask whether it's sharp or dull. Sharp or dull? Sharp. Dull.
Yeah, with your eyes closed.
Sharp. Dull.
Okay, great. And now I'm going to move on to another test for sensory, which is kinesthesia. So for this, I'm going to take the hand, I'm going to put it like this, and I'm going to say, show the patient, this is up, this is down, this is up, this is down, this is up, this is down. And then I'm going to have the patient close their eyes, and I'm going to test, and I'm going to have them, I'm going to move their finger, and I'm going to have them tell me whether it's up or down. Up or down?
Down, down, up.
Great. And now I'm going to do stereognosis. So to do that, I'm going to give the patient a familiar object, and I'm going to put it in their hand with their eyes closed, and they're going to have to tell me what this object is.
A key.
Okay, great. A key. And now I'm going to do graphesthesia, which I'm going to test with the patient with their eyes closed, and I'm going to draw a letter, a capital letter, in their hand, and they'll tell me what it is. A. Great. Okay, and now I'm going to look at the deep tendon reflexes. Using my hammer, I would use the sharp pointy side for anything above the waist and the dull side for anything below. So the first one I'm going to do is the brachioradialis. So I'm going to hold the patient. I'm going to support their arm for them, and I'm going to hit here, and we're looking for supination of the hand. Great. And now I'm going to do the triceps, which I would test like this, supporting the arm. And I would hit on the tendon of the triceps and expect extension of the arm. Then I'm going to test the biceps reflex. So again, I'm going to support the arm, and I would be hitting on my own thumb for the one for the brachialis and the one for the biceps. So now I'm going to do the biceps one. And we'd expect flexion. And for the patellar reflex, I'm going to have the patient sit forward, and you would want the leg hanging, so I'm going to have you cross your legs off unsupported, and I'm going to hit the patella, and I'm going to expect extension. Great. And now I'm going to do the Achilles, so I'm going to have the patient stand up and kneel with one leg onto the chair, and I'm going to hit on the Achilles tendon and expect plantar flexion. And then finally is the plantar reflex, also known and also testing for the Babinski reflex, which I'm going to do demonstrating on the patient's hand. So I'm going to make an upside down J, and I'm going to look for slight curling of the fingers coming up the lateral side, or nothing at all. That's normal. A positive Babinski would be in an adult if the toes fanned, or in an infant if but in an infant that is normal, the Babinski. So the toes would fan in an infant, and that would be normal. Okay, so that is all. Thank you.